My name is Christiana Johnson. I work for the Public Health Directorate currently in NHS Kirklees, and my role is Capacity and Capability Programme Management, and that involves commissioning and delivering in some circumstances public health training. We have a public health training programme within within the PCT that is multidisciplinary and multi-agency. So we already had quite a lot of contacts with the local authority, and we already had brief intervention, motivational interviewing, more sophisticated CBA type stuff. So the two levels 2, 3 and 4 were pretty well covered, but there was a gap around level 1. Because we'd got contact with the council, and they were we're starting to work more with them than with other partners in the short term. Yep. What I did was make some links with some of those colleagues. Okay. So, it felt like the health service offer was already on the table pretty much. Yeah. And what we were doing was looking at a different cohort of staff entirely. What we did was did some presentations at some fairly senior level meetings. Yep. The health and wellbeing groups that were formed already in the council and were already, in terms of selling the message. Yep. You don't have to do too much in terms of buy-in.
They were already active.
They were active. They were thinking about the issues. They were really clear about the overlap between the wider determinants and behaviour change. But we worked with that group to present the notion that we could do some frontline work that was very introductory. Right. And the benefits would be as much to the staff thinking about the possibility of a new role for them and how we were going to get them there. And we anticipated lots of stuff that would be potentially problematic, like it's not my job. Yeah. Have I got the legitimacy to ask these questions, or to not even ask these questions, to indicate we're doing this and this. Yeah. Okay. So we ended up with two 2-hour sessions. Right. And we picked staff from a range of services like housing, staff who came into contact with perhaps vulnerable tenants. Yes. People working in sports centres who were at reception, who might want further signposting information and so on. So we designed it so that the first session was really making the case, if you like, around behaviour change. Why is this important? Right. Yeah. Why is it important for you, an employee of the council? Yes. In relation to this, and really trying to make it clear that this is just an extension of good customer care, and kind of looking after the whole person. Okay. And some people got it like that. It was really interesting, in terms of the session, because it was multidisciplinary across there's different staff groups. Yeah. You might get one person being quite resistant, of course, following the model. Yes. And somebody else saying, but hang on a minute, we could do it like this. Yeah. So within that session, there were ideas being sparked. Good. We developed a guide for staff, which was very simple. Yeah. It didn't have a lot of health information in it. It had a few key messages, some ideas for how you might nudge, and a lot of the accurate, up-to-date signposting information. I mean, I think in terms of the successes, what it's starting to do is bring the responsibility around health and well-being. Yes. It's increased the awareness within a whole cohort of staff that didn't have it before. That's actually quite a big deal. It's raised the profile of public health messages, awareness, and individual responsibility, as well as as a council, what are we doing? Yeah. And we are doing a lot already. But what are the triggers? What are the triggers that get people going? And they are many and various, so I think it's had an impact organisationally. Mm-hmm. It's also helped to start identifying some staff who might want to do a higher level training. Okay. Because they can access that in the public health training programme. Yeah. And also people have sort of fed back individually that it's made them think about their own health. Okay. And make some minor changes in relation to that. Or challenge things like, why do we all have cakes for every birthday? And it also is starting to close the loop in terms of staff health and well-being. Yes. within the big employers,
Yeah.
like the council and the NHS.
Yeah.
So there's lots of partnership opportunity that's being taken up and developed. There are some champions in the council already.
Good.
In a particular sort of part of the council, and what we're trying to do is link all of that up so that they can take on the role of being Every Contact Counts champions, as well as being, because it makes absolute sense.
Of course.
And we want them involved in developing the training for the next level for council staff.
Yeah.
So the synergy at the moment feels really, really positive. I think we could do loads more with we engage in the voluntary sector, some of the emergency services who've got a community role.
Yeah.
They'd be really keen to get on board. We haven't explored that yet because of the capacity issues.
Of course.
But we're going that way.
Okay.
And certainly if we get... I think part of doing it like this means that the awareness has increased at senior level.
Yes.
And so we're more likely to get buy-in for some of these other activities that we want to roll out.
Okay. Would you say, therefore, that what you've begun to do by making every contact count, and obviously the framework connected to that, it's being able to raise the profile of this subject matter, that it is everybody's business?
Absolutely. Without a doubt. The number of people that quote Every Contact Count at me in different settings has really, increased. We've got an e-learning section to that now.
Right, okay.
So that effectively replaces the first 2-hour session.
Right, okay.
Gets people to go through the same thought processes. It's really about getting people to think and reflect through, in my role, how could I make a difference?
Mm-hmm.
And so when they come to the actual face-to-face training, they're primed and they've had some opportunities to think about it. And that's being rolled out now as we speak. So the first few sessions of that are being done, and I think that'll be a bit of a winner really. For me, I think this has got to be something about building on the emotional intelligence of staff. I think there are some people who maybe will find it harder than others to use messages in an appropriate way. But I think in terms of the approach, the kind of broad brush approach, it's been really useful. And I think in terms of some of the putting down the competencies in a clear way against other frameworks, that's been helpful as well. Because it is everybody's business, but we don't all necessarily speak the same language while we're doing it.